binder. So basically it's going to be like a little Frankenstein binder of any resources that are going to be helpful specific to you, where you're working, what needs you have, if you're having any challenging areas or things you want to remember. So it's all going to be different to you. You'll see that mine is heavily onto antipsychotics and the community mental health, because that's the setting I work in, right? So if I was working with kids, this would be more tailored to kids. If I was addiction medicine, inpatient, so on and so forth. The resources that you're going to need the most in a pinch, okay? So first page, I always have, obviously, I hid my actual directory, but hospital, clinic directory, your address, your facility, your extensions for your clinic, who you refer out to if you're outpatient. So like for us right now, we don't have a TMS in our facility, so we refer out for TMS, ECT, ketamine, and Spravato. I have our transportation numbers because a lot of our patients need transport set up to come to their appointments. I got our interpreter line, lab, pharmacy, if you have an in-house pharmacy. It's good to know that. This is key right here too, your community resources. Make a list of where your local food banks are, your free clinics, free dental care, shelters, and group homes, because when you have the patient sitting with you, it's nice to be able to give them some resources when you hear about, different things going on in their life. Also a list of my coworkers and their roles. So this is key too. Anytime you start a new job, it's always good to kind of make a list of who your coworkers are and what their roles are, because it really makes you stand out when you don't have to keep going back and saying what's your name? What do you do here? What do you do here? So I like to make sure to go out of my way, even if you have to jot it down on your phone. Your nurses, your therapists, your case managers, peer supports, who they are, their contact, what they do, and their role. So this is going to be, again, specific to your facility. Then on my second page, I have my login and my credentials. So I know some people don't want to write it down. Keep it on your phone, wherever you want to keep it. But for me, when I'm right there at my desk, let me just pop this open, because, we have so many logins, so many passwords, so many numbers to remember. So my computer, my email, my EMR access, my prescription monitoring to the state pharmacy portal, my NPI number, my DEA. I don't have them memorized, so I do have them written down. And that way it's just easy to, okay, what's my login, right? All right, then I have my one sheet diagnosis page. So pretty much your main conditions and how do you treat them on one page. And some notes for some other disorders, my quick reference to psych meds. So there's different tables. So you got your antidepressants, your bipolar meds, your stimulants, labs to draw, lab monitoring. And again, I got these all from different places. So and as you get familiar or you get comfortable with one, you may not need it anymore. You can just take it out and add other things, right? So these are my medications for acute agitation, inpatient. So I don't work inpatient, but when your patient happens to go inpatient, they will call you from the hospital to do a report, a peer-to-peer, or doc-to-doc, whatever they call it. And they're going to tell you these are the medications that they started them on. So it's really good to be familiar with what's being used in the acute setting. I have my clozapine checklist. This one I use all the time. This is my long-acting injectables LAI reference. So it has the meds, when to start them, if they miss doses for maintenance, how to set them up. This is several pages. This is from the CARLAT report. So if you're working community mental health, definitely have a resource for LAIs. Love them, get to know them, be super familiar with them, because I would say probably 80% of my patients are on LAIs. They're court ordered, that kind of thing. Very, very common in community mental health. Not so much in other settings, or if you don't work with SMI population, but if you are, or you're starting a job with that, you need to have a LAI reference. Another thing I do is keep, so I got this from a pharmacy rep, and this is specific to Invega. It has all your details, how to start it, when to stop it, that kind of thing. These are good from your drug reps. Also, I keep a little resource of the injections, leaflets too, the most common ones, which was really helpful as a new grad too, to get really familiar with them. And I still go back to those. Again, and more LAI guidance for LAIs from the SMI advisor. EPS treatment, so for your side effects, and we got this different side effects and which medications are best for it, and which ones will cover all of them or some of them. This is a reference from when I was in clinicals, actually. So those students who are in clinicals, anytime your preceptor gives you some reference or pearls, try to keep note of it, because this has been helpful too. Just some charts that I've made, some algorithms. I have a note from the CARLAT psychiatry report, how to start Suboxone in the outpatient, which is for opiate use disorder, an algorithm for that. I did used to work inpatient detox, but outpatient's a little bit different in how they start it. Also, we are not a MAT clinic where I work at, but sometimes we'll get a patient that needs to, been out of the hospital or just got started on it. Sometimes we need to continue doses, so being familiar on how to do that is key. We got our AIMS scoring for abnormal movement. Anytime you have a patient on antipsychotic, we're checking for tardive dyskinesia. And I have a description on each, detailed on what each one portion means, and then the actual scale. Then I have my psych eval cheat sheet. So this is one page for the psych eval. Obviously, you're going to use it on the computer most times, but sometimes the computer's down, or if you're a really busy day, or you want to double check to make sure you don't forget anything, this is a good cheat sheet to kind of help you with the flow of your interview. Then I have the psych eval, the longer template, and I also have these ones I have in on my email too. I emailed them to myself too. So then we got the DSM-5 checklist. So these are actually DSM-5 criteria for all these conditions, and as you're going through your interview, you can check off boxes and see which ones they're kind of meeting to kind of formulate your diagnosis. The back page, then we got our review of systems. This is your medical score assessment portion that we have to do in the psych eval, all the systems that we go through. Your mental status exam details on, and there's several pages in here too. This one is the review of systems. This is specifically to psych review of systems, questions to go over. And then I have a little cheat sheet for like follow-ups. So I made this. I'll just like circle which one it is if I'm doing a psych no, virtual, hospital discharge appointment, and just the key components to not miss. Labs, and then a little checklist at the end of my appointment. Did I send in their meds to the pharmacy? Is my note done? Did I check the pharmacy portal? And then did I also get consents before they left? So just little reminders. Gene site testing. I got this from their rep too. So if I'm discussing gene site testing for a patient, I'll show them this, like, hey, like trying to explain to them what it looks like, what theirs will look like, and how we'll kind of go from there. Yeah, so that's it for the one that I currently use. Really quick, this is the one that I use for inpatient detox. So the first page, it has like a clear cover. I have the calendar for the on-call, so all the highlighted dates were when I was on call. This is from 2022, so and then that way I would make sure that I was well aware when I was on call. Then in inpatient, a lot of times they have standing orders, so that means that the facility already has orders that they're going to use for admissions, but I keep a copy because at the end of the day, your name is on the standing orders, whether they were there before you or not, right? Then I had our detox protocol that we would do. This is for opiates, and we had our benzos. I was an FNP there, so I also had our insulin sliding scales, because when they would call, nurses would call you, they would ask you for orders like, hey, the patient's blood sugar is blah, 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 and then you would have to give them the orders based on that, and then, blood pressure guidelines. And